Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanuatu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts.
Hi, ladies and gentlemen. Once again, it is time to come your way with the online pregnancy school. As I say, it is always a pleasure to come your way with the online pregnancy school, because what we are doing is trying to prevent those preventable maternal and newborn deaths. Remember, I have said that around the world, every single day, about 800 women lose their lives because of pregnancy and related complications. And then we have about 7,000 babies also dying. And this cannot be allowed to continue. And that is why I'm inviting you to join me, Dr. Linda Vanuatu, as we go on this journey. So if you have not yet subscribed, please go ahead and hit that subscribe button. Remember to turn on the notification bell so that you will be informed anytime we have a program coming up. And please, if we will be able to reduce these deaths, we cannot do that as individuals. That's why I'm calling on you to invite other people, share with them, because all the people who come to the program to discuss issues are really experts in those areas. And that is why we want you to continue joining us anytime we have a session coming up. For those who have been joining us over the period, I say a very big thank you. Please continue to join us. And for those who are now seeing this program, join us. Don't leave. Share with others. Everybody has a role to play. I hope you will do that. Well, in the previous sessions, we have spoken a lot about pregnancy. We have said a lot about what the pregnant woman goes through. We have even spoken about how the men can be involved, and that is very important. Today, I have a wonderful person joining me. She will introduce herself, and you know why she's so wonderful. We have people who are passionate about maternal and child health, and she's one of them. Let me introduce to you my guest for today, and I call her Isabella, but she will introduce herself to us. Isabella, you are most welcome.
Thank you very much. Yes.
Please introduce yourself to us.
All right. My name is Isabella Sagoe-Moses, and I work with the Ghana Health Service. I am a child health specialist. So I'm a doctor and I specialize in child health. I've worked with the Ghana Health Service for several years.
Hey!
Since 1989.
Wow.
And for the past 21 years, I've been at the headquarters level. First, I started off as the National Child Health Coordinator. And now I'm the head of Reproductive and Child Health Department.
Wow.
Under the Family Health Division.
Wow.
So that is who I am.
You know, I told you that she's a wonderful person. Over 20 years looking at issues to do with reproductive and child health. Oh, Isabella, you are most welcome. This is the online pregnancy school. You know about the pregnancy school because you know about the promise. And one of these days, I'm going to do a session where I will tell people what the promise is all about. But this is part of the promise, as you know, and you have been a very good advocate of the promise initiative. So we thank you so much. Today, we are going to talk about child health. But before we do that, kindly explain a few of the words that you have used, because you said reproductive and child health. What is reproductive health?
So reproductive health has to do with everything surrounding pregnancy, delivery, and the woman's system that supports childbirth and pregnancy and childbirth. So when we talk about reproductive, that is it. So maybe in simple terms, we'll talk about antenatal care, we'll talk about deliveries, talk about family planning, all that aspect is reproductive health. Yes.
Yeah, thank you very much. So viewers, if you are just joining us, we have done sessions on fertility. So if you go back to our previous sessions, you see that we spoke about fertility, reproductive health. We have that as part of it. We have spoken about menstruation. So all these are part of it. And we have done a lot about pregnancy. So please go back to the previous videos. We have over 50 videos just for you. So go back and look at that. But today, Isabella, we are going to focus on the child. And before we zoom into the child, we have some terms that we hear of. For example, I said that every day around the world, we have 7,000 babies born dead and all that. So kindly explain to us the definitions of the term newborn, a neonate, and a child. Who are these people?
So broadly speaking, when we talk about children, we define that as any time from birth up till 18 years. So anybody under the age of 18 is a child.
Okay.
But like you rightly said, there are groupings within this childhood period. And for the purposes of our discussion, we will focus on the children under the age of 5 years.
Okay.
Because that is the vulnerable group. That's the time when we are most concerned about. So generally, when you say child, talking about the vulnerable group, then we are looking at under 5s, those who are 5 years old. And then within that category, there are two other groupings. We have those below the age of 1.
Okay.
And we usually refer to them as infants.
Okay.
And then those, below 1 year of age, they are the infants. And then those below the age of 1 month, they are the newborns or neonates. So newborn and neonate is referring to the under 1 month olds. Strictly speaking, from birth up to 28 days of life is the newborn, the neonatal period.
Wow, ladies and gentlemen, I hope you have understood that. So children go up to 18 years, is that correct?
Yes.
But for today, we are focusing on under 5 because they are the vulnerable. What is the vulnerable group?
So they are the ones vulnerable in terms of health.
Yes.
In that they are the ones most at risk of falling sick easily and also dying easily.
Okay.
So we want to take special care of them. Because they are so young, they are new to the world, their bodies are still developing, and at the same time being exposed to environments which is not so friendly. So they are fragile, so to speak, and we want to handle them with the utmost care so that we preserve their lives for them to grow and develop into adulthood.
Okay, thank you very much. Distinguished ladies and gentlemen, if you have just joined us, we are talking about children today, and this is the online pregnancy school. Today, my guest is Dr. Isabella Sagoe-Moses. She is a child health specialist, and she's been doing this work for over 20-something years. So she's well versed in what she talks about. She has risen up to the national level. She works with the Ghana Health Service at the national level in the Family Health Division, that she's responsible for reproductive and child health. Today, we are looking at the child. Isabella, now that we have understood the various age bands, what are some of the challenges that lead to, unfortunately, sicknesses and deaths or morbidity and mortality let's start with the neonates, the first 28 days.
All right. So I would like to start by saying that when we are talking about children, especially the neonates, we have to also talk about their mothers. We want to start from pregnancy. because whatever happens during the pregnancy has a bearing on the health of the newborn once they are delivered. And so we start taking care of them during the antenatal period. And so if anything goes wrong with the pregnancy, either the child's life will be lost, so they are not even born at all, very early in pregnancy. Some of them will go almost to term, almost to full 9 months, or even to 9 months, and they are born already dead. So they come out from the womb and there is no sign of life in them. Others may be born too soon, before 9 months, way before 9 months, some 6 months, 7 months. And at that time, they are even more vulnerable because their bodies are not well matured to survive. And we need extra special care to make them survive. So pregnancy things can affect them. And then the time of delivery, whilst they're being birthed, that's critical time from when they've just come out of the womb. Again, things can go wrong at that time. Some of them come out, they are not breathing properly. They have to be helped to breathe.
Okay.
Some come out with other challenges. So things go wrong just immediately after delivery. And then within that time, the first week, we find out that in our part of the world, and even in other parts of the world, many tend to lose their lives within that first week. Because again, little things go wrong. And the sad thing is that during that period, when they are ill, it's very difficult for parents to detect that they are ill. So
Why?
because they tend not to show the typical signs of illness. For an older child who is ill, maybe the temperature will rise. You touch the body and it's warm.
Yeah.
For a newborn or neonate, they may not be warm. In fact, they may even be cold.
Yeah.
And yet they are very sick.
Oh.
Again, an older child may be restless, may be crying. The newborn, the only sign they may show is just to be very quiet, very still. And then, the mother or family will say, oh, this child is a very good child. They don't cry too much. Meanwhile, something may be seriously wrong. So because the untrained eye cannot pick up their illness, lives can be lost very quickly. And that is why we recommend that postnatal care, be adhered to. That we ourselves, immediately after birth, we try to check them very well before they go home, and then teach mothers about some signs to look out for, like the ones I've talked about. Sometimes they may just not want to feed, and it's because they are very sick.
Okay.
So when they come back for postnatal care, then the health worker can pick up some of these signs and intervene quickly. Apart from that, the environment itself is not so friendly, like I've said. And because their immune system is still developing, they easily catch infections.
Okay.
So if they are not handled well, the carers are not washing their hands before holding them, or somebody who is, sick comes around them, they quickly pick infections. Okay. So these are all things that can go wrong. Sometimes also things can go wrong with the feeding. We want them to breastfeed very early. They may not be able to breastfeed, or there are challenges with, making sure they are well positioned so that they can suckle effectively.
Yeah.
And that also happens. It can affect their health and their growth. So a lot can go wrong within the newborn period.
Wow. Ladies and gentlemen, that is a lot. It means that if you're at home, you have a newborn baby, Dr. Isabella has told us that within the first few days of life, it is critical. And that's why we have to take the antenatal very, very seriously. I think we have hammered on this several times. If you have a baby, you have taken the baby home, this baby is sleeping. The baby seems to be quiet. The baby is not sucking the breast very well. Don't think that this is a good baby. That is what she's telling us. Oh, this baby sleeps so well, gives me time to do what I have to do. The child may be sick. So as soon as you notice that, as quickly as you can, send that baby to the hospital. The midwives are there, the nurses are there, the doctors are there. They will check on this baby for you. That's what she's telling us, because you see, we want to prevent these deaths from happening. Some of them, we can prevent them, and that is why we want to do that. So please, Dr. Isabella has told us a lot about the neonate, the newborn baby. So please, let's adhere to that. If you have just joined us, this is the online pregnancy school, and today we are looking at the child. My guest is Dr. Isabella Sagoe-Moses. She's a child health specialist. And my name is Dr. Linda Vanutu. If you have not yet subscribed, please go ahead, hit that subscribe button. Also, turn on the notification bell. So anytime we have a program coming up, you will be informed and you will join us. We are on a journey. We want to stop at least those that can be prevented, these deaths that can be prevented. Let's stop them. We cannot allow families to be grieving all the time. A woman going through pregnancy with all the challenges, going home with empty hands. It is very painful. It is very sad. Or you go home with your baby and within 1 week, 1 day, 1 month, 1 year, the baby is gone. We don't want to have those stories continuing. So join us. Join Dr. Isabella, join myself, join all the people who are struggling to get this to be done. It is a good cause. So join us. Isabella, thank you very much. Please, let's move on. So what we have to know about the child again?
Yes. So another aspect is feeding. I already started about breastfeeding and about feeding a child. Breast milk is the first, most nutritious food. And it also provides all the water that the newborn needs. And we recommend that breastfeeding is started within the first hour after delivery. The baby is put to breast. In fact, if the baby comes out of the womb and is placed on the mother's tummy, naturally, they tend to find their way to the breast and start sucking. They know what is good for them. And that is what we want.
Yeah.
Because apart from it being food and drink for them, it also gives them their first immunization, so to speak, against all the dangerous things in the world they are coming to. Yeah. The mother passes on some immunity to the baby through breastfeeding. And we want them to feed only on breast milk without adding water, without adding food, without adding any other thing for the first 6 months of life. Then after 6 months, we add other foods, the family foods, so we call complementary feeding. I'm talking about feeding the infant and the child at this time because nutrition is so important. If the child is well nourished, most of the things that they encounter, they can easily get over them. Okay. Malaria, diarrhea, pneumonia. These are the common infections that plague us in this part of the world and the common causes of illness and death in newborns and in children. But if they are well nourished, their bodies are able, with treatment also, to get over. Okay. If they are not well nourished, then they are at a higher risk, first of all, of contracting the conditions that I've mentioned. And then when they get them also, they are at a higher risk of losing their lives. So infant and young child feeding is so important and must start right from birth with breastfeeding And then after 6 months, with the addition of other family foods. So,
wow.
nutrition.
And you see, breast milk is it is there. You are not going to pay for it.
No.
It is already cooked, so to speak, with the
Mhm.
right amount of water, with the right amount of whatever should be there. It is
The
about
right temperature.
yes, the right temperature. Distinguished ladies and gentlemen, one of these days we'll be talking about breastfeeding into detail, and we'll show people how to put the baby to their breast. Because Isabella, you know, sometimes it is about the attachment, it's about the positioning, and that gives the women some challenges. And these things are taught at the antenatal and even at the pregnancy school. So we will do that session again to let people know how to put the baby to their breast, how to do that properly, so that this baby will not be sucking air. So you see that the tummy is there, but the baby is still crying. The tummy is big, the baby is crying, and they say, oh, the baby is not full, especially about the water. You know, people don't believe that the breast milk has enough water and enough nutrients, which will be good for this baby. Wow. But today we are hearing that it is enough for the baby, for the first 6 months of the baby's life. Just give that baby the breast milk, and you see how the baby will grow. The baby will grow very well. And you also prevent all these diseases that we are talking about. Isabella, you have mentioned some of the causes of morbidity and mortality, that is sickness and death in these babies. But is it that high that we should be concerned about? Are these babies really dying that we should be concerned about?
Yes, they are. As we speak currently, from the latest figures we have, 25 out of every 1,000 babies die before they reach the 1 month, which means they die within the neonatal period. 25 out of every 1,000. If you work that out, so 2 out of every 100 will lose their lives before they reach the 1 month of age. And going further, about 52 within the under 5 age group, 52 out of 1,000 will also die before they reach 5 years of age. So it is quite worrying, especially because we know how to prevent the causes of death. So they shouldn't really be dying. But unfortunately, that's the situation we find ourselves in. So it is disturbing. And like I said, of all the newborns who would die, 75% of them would die within the first 1 week.
Wow, that is very painful, because you actually went home with the baby. And the joy has started. And the woman is even trying to overcome the challenges of pregnancy and of delivery and all that. Then within 1 week, the baby is gone. That is really very difficult and very sad. 75% of them.
Yes. 75% of those who will die within 1 month, the death occurs in the first week. In the first week.
That's why we are on this journey together. That's why I'm calling on everybody. If you are listening to us, this is the online pregnancy school. I'm talking to Dr. Isabella Sagoe-Moses. She is responsible for reproductive and child health for Ghana. So she knows what she's talking about. The statistics are what she's sharing with us. We don't want 25 out of 1,000 babies dying. We don't want 50 out of 1,000 dying. We don't want those 75% dying in the first. Can you imagine? You have prepared for this baby, and then within 1 week, the baby just goes away like that. And she said that we know how to prevent this. That's why, ladies and gentlemen, I'm calling on you to join us. If you have not yet done that, please go ahead. Hit that subscribe button, turn on the notification bell, and share with others. And encourage people to adhere to whatever they are told. Antenatal is very important. So much is done. So they should adhere to whatever they are told. And if they have any challenges, Isabella, one good thing these days is that the midwives want also to prevent these deaths. So they
Yes.
share their phone numbers with them. Some of them have WhatsApp groups where people can post questions, ask questions, and get in touch with them. So if you go home and you have any challenges, do not stay at home. Get in touch with them. Or if you cannot go to where you delivered, just get your baby, go to the nearest health facility, and they will not sack you. They will take care of that baby for you, because we want to prevent these deaths. They are preventable. They are preventable. Isabella, so now that we have gone past the neonate, they're under 5.
Yes.
What kills them? Those
They're
that are
under
big
5.
grown after 1 year.
Yes, the common causes are malaria, diarrhea, and acute respiratory infections. That's a long word, but the most important of them is pneumonia.
Okay.
And then there are other conditions, but these are the commonest. And then I mentioned malnutrition. Is a big, yes. So that is what is killing these young ones. And if you listen to the things I talked about, they are not some strange things. They've been with us all along. We know how to prevent them. So why should our children be dying from them?
That's the question I want to ask you.
Yes. So let's take, for example, malaria. We talk about sleeping in an insecticide-treated net every night to prevent malaria. And yet, people give excuses. The net is too warm. The net is, you'll be like a cop sleeping under a white net. So they sleep outside the net, and then children get bitten. And with children, when they have malaria, it is really, really serious. Within a time, their lives can be lost. Talk about pneumonia and diarrhea. We know how to prevent a number of these through immunizations. Again, people have all kinds of excuses and reasons why they mustn't go for vaccines. Unfortunately, these negative news spreaders have got a platform now that we have social media. So they put some kind of fear and uncertainty in people. It's not all about COVID, you know. The negative things about vaccinations go way back and affect childhood vaccinations also. So if the child is not vaccinated, then they come down with all, you know, some of the dangerous causes of pneumonia and diarrhea that could have been prevented. Hand washing, very easy. Wash your hands, wash fresh fruits. Make sure you wash your hands before the child is fed. That way the child will not come down with diarrhea. Unfortunately, this doesn't always happen, and some children get diarrhea. And we say when a child has diarrhea, give ORS, give a lot to drink. No, some would do otherwise. Then the children get complications and their lives are lost. So that is why I was saying that, you know, 70% of the cases can be prevented if only we would do the little things and adhere to the recommendations that are being given. Yes.
Wow. It's really unfortunate that babies should die, children should die because of preventable things, you know, and the things are available. Ladies and gentlemen, today, my guest is Dr. Isabella Sagoe-Moses. She is a reproductive and child health specialist taking care of the country, Ghana's reproductive and child health. She's been doing this for a very long time, very passionate about the child. And I'm sure from what you have heard, you understand why I say that. She is very passionate. And all of us are looking up to you to join us. So if you haven't done that, go ahead and hit that subscribe button and also share. Because you see, the information is for us to share. It's not for you to keep. Otherwise, we will not be doing the right thing. People will continue to die when they shouldn't. You don't know that child, what that child will do in the future for us as a country and even for the whole of mankind. So please help us to help families to keep these children alive. Today, we were talking about the child. We have had definitions for the newborn, the neonate, and the child. And our focus was on the child under 5 years, because as Isabella said, that group is vulnerable. And vulnerable means that they can easily come down with disease, they can easily die for several reasons. And she has given us a lot of the things that could happen within this age group for which we can prevent these deaths. Isabella, as we bring this session of our presentation to an end, we have the second session coming up where we'll continue talking about the child. But what are your parting words for those who are listening to us?
I will say that please, when you are pregnant, go for antenatal care. Child survival starts with good antenatal care.
Yeah.
And then make sure that you deliver within a health facility under trained hands. That way, if anything is going wrong, there will be an intervention to rescue the situation and make sure the child survives. And then after delivery, make sure you attend postnatal care so that, again, anything going wrong with a newborn can be picked up quickly and intervened so that the child will survive. Adhere to all the instructions that the healthcare workers give you from antenatal through delivery through postnatal. Children need not die. Most of the time, we can prevent the causes of death and their lives can be saved. So do your part as we, the health workers, also do ours. Thank you.
You couldn't have ended on a better note. These children need not die. That is what Dr. Sagoe-Moses is telling us. And these deaths are preventable. That is where we come in. They are preventable, and that's why we are asking you to join us so that we prevent these preventable deaths. I hope you have enjoyed this session where we have given you some insight as to what lead to the death of these babies and their children. No child should suffer because he or she was neglected. And I'm saying neglected because the child couldn't have gone to the hospital himself or herself. The child couldn't have given himself or herself food. It depends on us adults to do that. So please, adults, let's take good care of these children. Let them survive because they can survive. Dr. Sagoe-Moses, thank you very much for this wonderful discussion. And I know that a lot of people have heard you and you are very, very well respected in this area. So they know that what you are telling us is exactly as is. And the statistics are really unfortunate because they could be lower. They could be lower. So thank you so much. And
you're welcome.
Yes, we will continue with our discussion and then we'll learn more about child health in Ghana. And I'm sure it also applies to other countries. Thank you.
Welcome.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts.